Welcome back.
We are now joined for our second segment by Enrique Romero, good morning, sir, and Miss Laura Longsworth, and they're both representatives of the National AIDS Commission. Good morning, ladies and gentlemen.
Good morning.
We have an interesting conversation this morning with regards to barriers to accessing healthcare services for people who are living with HIV/AIDS.
Yes, that's right.
Can I start off just by finding out, it's interesting that you had the presentation, the conference on Friday.
Yes.
Typically, we're used to talking about issues on a seasonal basis, and World AIDS Day is December 1st, so we're far ahead of that. But obviously, this is an effort of keeping the conversation going outside of awareness days, and we know your work continues throughout the year.
That's right.
So let's talk about what the impetus was to be able to get this conversation going at this point in time.
Certainly. First of all, I am the chair of the National AIDS Commission, and Mr. Romero is our absolutely reliable, supportive executive director who is leading all the activities of the National AIDS Commission. The National AIDS Commission has to do with the national response. And oftentimes when we speak about the commission, we think that about the commission not in its entirety. The commission consists of key stakeholders from a wide cross-section of the community, with the biggest implementer and caregiver being the Ministry of Health, who sits with us at the table. We also have members of the LGBT community at every step of the way. And so we have other persons in the community who are active, are sub-recipients of our Global Fund and so on. So yes, the information is very important. We haven't done a very good job of keeping the community abreast of all this information. And because of that, sometimes the information is misunderstood and misrepresented. So then since January of this year, the national response has been benefiting from funds from the Global Fund. And we were very successful in obtaining funds to carry out a series of activities over the next 2 years.
3 years.
3 years to address the HIV/AIDS and TB. And TB is now added to that as a one-time to get our TB program up and running. And I don't know that people realize, but one out of every 4 or 5 persons with HIV has TB. Because they're vulnerable. So that's why now the whole response is towards HIV, AIDS, and TB. So yes, the information sharing is very important. There's a wide national response, and I think as we progress this morning, we'll be able to share the extent of the activity that we have been engaged in over the past year.
Go ahead.
This conversation comes on the heels of an event that was held on Friday, correct?
That's correct.
Where the discussion was indeed barriers and what have you.
Correct.
Can you expand a bit on that so we can put it into some perspective?
Certainly. There are several things that have happened this year. We've had the UN high-level meeting in New York on HIV/AIDS, and we've also had a World AIDS conference in Durban. It's interesting to note that the Special Envoy for HIV/AIDS in the Caribbean, Dr. Green, you may have had him on your show at some point, issued a warning to us because there's a slippage in the gains that have been made in the Caribbean. And I think it's like a 9% increase above and beyond what it used to be. And that is, interestingly, it reflects a pattern that we're seeing in Belize as well. And we heard that on Friday from the Director of Health Services, Dr. Manzanero. I need to offer his apologies. He could not be with us this morning. And so the conference on Friday really highlighted 2 things. That there's a slippage and we need to sit down up. And Dr. Green says that it's complacency that's causing the whole thing. Getting very comfortable
And that was one point I wanted to look at.
Yes.
Typically what we as a public pay attention to when we hear statistics about HIV it's the number of new infections. In other words, how many new people contracted the virus on a yearly basis. Right. And we had been seeing a reduction in numbers. Yes. But one of the key factors I know that persons who work in this particular sector keep on saying is that's only representative of those who get tested. Right. Let's paint the picture as to what the actual number of persons or demographic of persons who are infected and affected by HIV actually are.
Right.
Right. As Mrs. Longsworth mentioned, you had asked about the discussion reference, the forum and the barriers. The UN high-level meeting that was held in June in New York, the Sustainable Development Goals, the AIDS conference that was held in Durban, South Africa, all speak to one thing: leaving no one behind. Therefore, it is imperative that we start to take actions to ensure that no one is left behind, including addressing those barriers to access to healthcare services. You asked about statistics. Over the 5 years, the statistics for Belize for new infections have ranged between 221, 241, 226, 239. So basically, it has stalled. We have not seen a steady decrease in new infections. So as Ms. Laura mentioned, Dr. Green highlighted these alarming trends. So hence the reason why we need to address the issues of barriers to accessing to care, testing. Adherence to treatment, and ultimately viral load suppression, which is our ultimate goal. No? And again, it goes in line with UNAIDS 1990 goals, which is getting 90% of people living with HIV tested and knowing their status,
and on treatment.
90% of those on treatment, and 90% of those that are on treatment, viral load suppression.
Because the viral load suppression prevents transmission.
In other words, how much of the virus you have.
That's right. And the whole, you ask about testing. There are lots of barriers. I mean, more women get tested in Belize than men at every turn. But even with the fact that you have medication available free of cost to everybody in the country, you still are having alarming deaths from HIV because there's stigma in terms of taking medications. People see you doing that, and so our citizens don't stay on their ARVs, and so ultimately they become very sick, and oftentimes, develop all that syndrome of HIV/AIDS and so on. It's very important. The conference was very important because it allowed us to put in perspective the whole issue of HIV and what is being done and what needs to be done. There, you did have the political high declaration that calls for high leadership, strong leadership, strong participation from the community, multisectorial, intersectorial, and multisectorial, and most importantly, for new attention to be given to women and children, for attention to be given to the 1990 strategy that Enrique mentioned, making sure everybody's tested, everybody knows their status, those that know it are on treatment, and your viral load suppression. In that regards, there's a lot of activities going on in Belize. For instance, as a part of the Global Fund, the Ministry of Health has been strengthened. The laboratory has been hundreds of thousands of dollars of testing equipment and supplies, so that our citizens can know their status. They can also know their viral load, which is very important. But we have a long way to go in terms of getting information to the country. It's an attitude. It's an attitude towards health. It's an attitude towards our sexual and reproductive health. It's an attitude towards our sexual behavior. And that's, we skirt around the problem in Belize. We are not very willing to address it. For instance, the call was to make sure that our children are educated. We have a stalled HFLE curriculum that's going nowhere, apparently. I don't know, I'm a grandmother and a great grandmother. I don't know how parents feel when their children are deprived of their sex education, because whether you give it to them or not, those children are going to be curious, interested, and will engage.
And I suppose
in sex
the better point is, if they're going to be deprived of the proper information,
exactly.
they will get it.
Right.
Yes, and so we're hoping to over the next year or so engage the families and parents in and all that. So the forum was interesting because we addressed those issues. We looked at the statistics, the really sad situation of having the medication available but not being the uptake being low, and of course the other issues of stigma and discrimination. We heard, for instance, where families are within families, there's discrimination. There's discrimination when one person becomes diagnosed. We hear of workplaces, and we have worked tremendously with workplaces to put in place an HIV workplace policy. And not many companies can produce one, and even so, they're still being requested, employees are still being asked to provide their HIV information. That's a violation of their human rights, because so what if you have HIV? If you're on your medication, nobody, you and I could be working with, you can be working with me and I'm HIV. I can look the same way I look once my viral load is suppressed.
Belize is such a small country that in today's day and age, it is difficult for one to say that I don't know someone who's affected by HIV/AIDS, either a family member, a friend, a colleague at work, a past classmate. You know, it's so small that you do have some knowledge of people who are infected. Why are we then still perpetuating this stigma and this discrimination, even though we're pretty much doing so against the very same people we know, basically?
Our friends or family.
Yeah.
And it's surprising that you mentioned that, because the UNAIDS data that was shared at the forum on Friday highlights Belizeans' tolerance towards HIV.
It was an online poll.
Yes. 3 out of every 4 Belizeans have no issue with having a person from the LGBT staying at their house, or shaking their hand, or with people, interacting with people from from the community. So it's very surprising that you have all these things on social media and all other stuff.
And I think that's one of the things I wanted to get at. The real root, in my perspective, of the issue are 2 things. One, in practice, Belizeans aren't as conservative as they speak. We know that from HIV indicators, we know that from teenage pregnancy indicators. When surveys are done with children in terms of the level of knowledge and exposure that they have, we know they're very exposed. So the talk in terms of the conservative practices that should be in place don't match our actions. Yet we still can't speak very openly about these behaviors that make us as the reproductive age, or those who are sexually active, vulnerable to infections like HIV. Now, how do we, I know the National AIDS Commission has worked before in accessing the churches, because that's really one of the areas that there has to be a stronger partnership. If the churches are saying, don't tell our children about negotiation skills for condoms or understanding risks that are in place, then these children won't get that information, and unfortunately may make decisions that put them more at risk. So what's been the engagement with the churches to kind of have them understand that what is happening in our society may not be what we would want people to subscribe to biblically, but we still have to do something.
We have to, because we have to take the public health approach. But certainly we have met over and over with faith-based organizations. We have a member of the Council of Churches on the National AIDS Commission, and he contributes, vociferously to the discussion. and understands the issue of the rights of the children to education and so on. We have had many interesting discussions. Many times the discussions come down to the church-state school system that we have, and whether it is okay for the church to dictate what our children learn, or shouldn't families have a more vibrant say in that regard. Nevertheless, we remain engaged, and they come. We meet all the time, but it's a matter of getting to a point where the curriculum can be agreed on and so on, rather than being stalled. And I think we need to call on them to really understand that we're all talking about the same children, but if we care about them, we need to do better. And there was a recent meeting. The Special Envoy, Dr. Green, was here, and he is there's a big faith-based faith-based meeting in December, and he has invited 2-3 of the groups here to attend. And so that would be interesting, is that there are going to be all faith-based organizations at the conference to talk about the very things, the very questions that you asked this morning. How do we move forward? How do we help our children? And they all agree that we've got to do something about it. So I think that's where we go.
So that was the first point that I have recognized. Secondly, I think, and again, similarly as Taboo was talking about when and which people engage in sex, I think looking at the issue of gay rights, LGBT community, we had the recent ruling on Section 53, and I want to ask what impact that does. But we still know this is a vulnerable population. Do you feel, and maybe from that survey you can tell us, is it still a mentality where people feel that HIV is synonymous with being a part of the LGBT community? Is that still where we are at in terms of our attitudes or perceptions towards the infection?
That's a good question.
Right. I would say that is still the trend in terms of people associating HIV with LGBT. As a matter of fact, in one of the questions from the survey, one of the questions that was asked was whether people thought that LGBT having HIV was a punishment from God, and several indicated that they felt that was so. So there's that association of the disease with the LGBT community.
Yeah.
And again, in terms of Section 53 at the National AIDS Commission, we welcome the decision. Again, going back to the principle of leaving no one behind. On one hand, you expect us to fast track and scale up our HIV prevention services, adherence, and leading to viral load suppression. But then on the other hand, you have a barrier that prohibits us reaching these most vulnerable people.
I'm glad that you were able to raise that as a point as well. The last time I spoke with both of you formally in an interview setting, we were discussing Section 53 and the prison population.
You're right.
Let's have a conversation. Let's revisit that conversation to put this part of the situation into some context for those who may not be aware of how the ruling impacts the prison population.
Well, I think that what we are reminded is from the presentation from the Director of Health Services on Friday, who reminds us that the epidemic is not confined to the general population. It's really to a more smaller population of vulnerable citizens. And while you have we have lots of us heterosexuals having HIV/AIDS because of our whatever it is that we do, the concentration, the statistics show that you have a higher prevalence in certain key populations, the LGBT community, in particular men who have sex with men, and of course, children are vulnerable because through their moms, and then of course you have other populations like prisons, and the prison and that's a global thing.
Yes.
That's not unusual for the globe, and so what it requires is for us to have things in place, and so Section 53 is very important because then if you were, for instance, within a formal institution like prison, when you have a law that makes you a criminal, you know, it limits what the law-abiding authorities can do for you. With removing that, and we have accepted that it's just what it says, and that was highlighted at the workshop, the conference on Friday. Look, we're talking about behind closed doors. That's all that the law says. And so we don't take it any further than that. What the National AIDS Commission has, and for the country, and with support from the government, has expanded and front-loaded the whole investment for HIV/AIDS to address those very same situations, and to put structures in place to ensure that people are screened, because we have prisoners moving in and out, just like how you have people moving all over the place. You have people moving from country to country. That's not the point. You can't discriminate and stop people from traveling, stop people from accessing services, and so on. We have a right, and so to live and be free of intimidation and discrimination. And I think it's horrific that at this point, within the workplace, you have employees who don't want to work with persons diagnosed with HIV. And so it becomes a scary business. So that employee may have a doctor's appointment. Somebody will eventually probably say something or see that person going to a certain place for treatment and so on, and then that employee gets into a lot of trouble. We need to get our act together. We cannot continue that pattern. We have all the information. There's scientific data to show us how HIV is in. So we've got to get. We have to grow up. We've got to grow up.
When you paint it, when you speak of the scenario as you just did, it really does show me we became a bit complacent. I remember a teen where we used to talk about you can't catch HIV by touching someone. You can't catch HIV by hugging someone.
Exactly.
But if people are now in a place where they are fearful to interact with a person who's positive, then obviously we've lost some of that information.
And we're adults, and adults we're talking about.
Now, the fundamental, or I would say the first step, well, it depends on where you look at it, but in terms of intervention, is testing. If we know who's infected, we know where to work, we know who to target.
Exactly.
We have some geographical areas in Belize that has higher prevalence. So those areas are front-loading. The investment is big in those areas.
So let's talk about where we have identified gaps in terms of we know men need to be tested more. That's one of the first areas that we can speak about. But are we also talking about rural areas needing to be tested, urban areas? What's the predicament when it comes to testing for HIV?
Testing sites are all over the country. So you can get tested literally at all the testing centers in the country. The areas that are being targeted: Belize City, Belize District, Dangriga, and Cayo District. Right? Those are there's where you're seeing a higher prevalence. Certainly, the whole issue of education, though, and the situation of setting up the system, so people are not targeted when they go for treatment, and I think that's one of the issues. And Dr. Montanero spoke to the issue of integrated services. So when you walk into the health system, the environment is so friendly, whether you're from the LGBT community or not. The environment is so friendly that you'll be offered the services that you need without delay. And that is the goal.
I think part of and this is just an observation here. I think part of the issue that is faced on a day-to-day basis is the fact that someone may want to access the facility for either treatment or to get tested, but the level of confidentiality from within these respective institutions is very low, poor to say the least, that by the time that individual leaves that facility, a phone call or a text message gets sent by, guess who they are? And then it just goes on from there that someone accessed the facility, someone either of prominence or what have you, and then that information takes off like wildfire. By the time the individual gets back to work or home,
they're being
or to
treated
his
differently.
family, it's already out there, and that's how the discrimination and the stigma.
That is also one of the barriers that are prohibiting people for accessing care. And as Ms. Laura mentioned, in this current grant that we have from the Global Fund, monies are being used to engage the healthcare providers in training to address some of these same issues. There's monies being invested in strengthening the health system through ensuring that there's a user-friendly environment, LGBT-friendly environment when they come into the accessing the healthcare services. So there are monies being invested in addressing some of these issues. And to mention in terms of testing, which is the first pillar in the continuum cascade, continuum of care cascade, on a yearly basis, around 30,000 people are tested, 20,000 being women, 10,000 being men. So it's a 2-to-1. At the National AIDS Commission, we are cognizant of that trend, and we have taken steps to address some of these issues. For example, I know for Regional Testing Day, some of our partners, what they do is they visit establishments that are male-dominated, for example, Bowen and Bowen, and to do testing at the actual workplace.
At the utility company, construction site.
Rather than you wait for them to come in.
And
another initiative under this current grant also is that we have, for example, especially with the key populations, is that we have our partners going beyond that 8 to 5 hours to do testing. You do testing maybe at midnight, and you target the specific areas where you will find the key populations. So all these are initiatives.
We have to be innovative
exactly.
in getting to our population and making it friendly, especially for our men. We need to really make it friendly.
What are the barriers when it comes to accessing treatment? It's amazing because I think I once interviewed a person living with HIV who spoke about taking, I don't know, a dozen medication, one to counter the other, and really just living on so much medication to be able to survive and to stay healthy. And now some people are taking 1, 2 pills, like we would take our vitamins for the day. So what is the challenge in terms of getting persons who are diagnosed on treatment and maintenance, which is a problem outside of HIV, adhering to treatment?
So you're talking about two things: the maintenance, the actually getting on and then staying on, and then of course the other health aspects that comes with it, being healthy, because they're more vulnerable. When you have HIV infections, you're vulnerable to quite a bit, and your health status is very important. As long once you're diagnosed, you have access to antiretroviral treatment free of cost. The important thing is for you to stay on the medication. Now that is difficult, and it's the whole issue of adherence that will also be addressed in this global round of Global Fund to find out why you're not staying on, what can we do, what method would work, what will work for you, so we can help you to stay on your medication. And it's whether in the private or public sector, you have access to those ARVs. And so that's not the problem. What is disturbing is under 50% of those persons stay on their treatment, and that's why the director of health services was able to say that mid-year the numbers are already, the deaths from HIV is already at a disturbing level. And I understand him very well. He sent out the alarm. He says our attitude has to change. We've got to change our attitude, and I think we have to become a more caring society, look to ourselves within our families to reduce that whole issue of discrimination and that stigma that comes with taking medication.
Can we look at it from this point of view, where if you are aware of the type of risks you're taking in terms of sexual activity and what have you. So you'd have the testing that comes first. And then in a case where the individual has tested positive, they would have to come to some form of acceptance, is it? Where you'd say, you know what, this is my newfound reality. I am HIV positive, and I need to accept that I will live with this particular condition for the remainder of my life.
Which is what I wanted to mention in answering Marlene's question in terms of barriers. The biggest barrier has to do with self-accepting. Because there are many people that are living with HIV who are normal, healthy, strong, looking good.
Yeah.
So how do you convince a person, or how do you tell a person to take on medication, 3 pills every day for the rest of their life? When I'm healthy, I can do all my activities that I've been doing. So that in itself is one of the biggest barriers. Self-accepting and ensuring that you access the right.
Because then
There are great stories. I mean, I can remember a woman I met, Addie. Wonderful story. You know, you can't have relationships after being HIV positive. She had a baby after being diagnosed, and her baby is negative because they take care of themselves, they're on treatment, so life doesn't end. Ms. Lara, you had said something actually in your capacity in terms of cancer, but I think it is important. What is the message that we're saying when we talk about particular diseases? Is HIV still a deadly disease, or can people live once on treatment and taking care of themselves and getting checked in terms of their viral load, a good quality of life?
Absolutely, absolutely, that can happen. Granted, it's a lifelong thing, and so you have to remain in touch with your health provider. Sometimes you have resistance, you have your medication is changing. Your nutrition has to be optimal. And something you mentioned just now that very important, the whole issue of the woman having her baby and doing well. Belize is just on that point. We missed it. We missed the opportunity to be declared one of those countries that has eliminated the mother-to-child transmission of HIV. Every pregnant woman is tested, and once tested, put on ARVs, and the baby is born without. However, our women are also not coming to the clinic early enough, and many, the ones that don't come really are those who, some of them know that they're HIV positive, do not want to be on medication, and so the baby is discovered as being positive after the fact. And so again, that's another big strategy that we have to use to encourage our women. One, come to the clinic once you know you're pregnant, know your status, get on your treatment.
Don't breastfeed.
And that kind of thing. So they need to really, for the baby to be born free of HIV/AIDS, then the viral load has to be suppressed. And so we missed an opportunity, but hopefully we'll try again in I think it's 2018 to see if we can be one of those countries. There are only about 2 or 3 countries that have been declared in the region.
A lot of what I'm getting out of this conversation has to do with self-discipline as well, in the sense that to get someone to remain on his or her meds, it takes and requires a sense of, you know what, this is what I need to do regardless. And that has to do with self-discipline.
Yeah, but then on the other hand, we're human beings.
That's outside of HIV.
What happens to the stigma that comes with taking that? What happens if somebody finds out that you're on that? They're going to prevent you from getting a job or take a trip or getting
a loan.
So I think it's all of us, is a community involvement.
So really the largest issue is the stigma and discrimination.
It's huge. It barriers. It sets up roadblocks at every stage.
Well, and I think Isani was bringing up a really solid point in terms of adherence, and I think if the people who work with HIV are able to find a way to get people to stay on medication globally, a lot of issues can be solved, because diabetics don't stay on medication, hypertensives don't stay on medication.
It's not the truth. Yes.
We don't, the antibiotic resistance is a problem because people don't adhere properly.
And the important thing of adherence is that it does not only allow the individual to live a more healthier life, it also aids in reducing the risk of transmission.
That is
which is very important. So it's not only about yourself, but your partner and the people that you
taking responsibility for your partner.
Exactly.
Yes.
So given the recent information coming from UNAIDS, given the forum where you had open conversations about where some of the identified challenges are, what would you say is your renewed commitment in terms of where you'd like to focus in addressing HIV/AIDS in Belize?
I think the big focus has to be the issue of stigma.
Yeah.
And that of discrimination, because you find it at every level. And it is unfair for members of our key population to be targeted at any time. And I think that over the next few weeks, hopefully we'll hear more from them as we move towards World AIDS Day, because it's very important to understand that we're citizens of a country and we have human rights and we operate under our constitution.
Should we move to legislate against discrimination in the workplace, for example, or in other areas where accessing healthcare or disclosing HIV status? Should that be perhaps part of?
I think we could look at policies. If a company adopts a policy, a non-discrimination policy within the workplace, that would be like an amazing step. Every company. But I think that in these times, we should not be requiring people to present their HIV status. The whole world will know then. One, it's your private and confidential situation, and it's linked to barriers. But I think that if we got that done, that would be like amazing, and we've done a lot of work on it, but we're still not there yet.
This was actually addressed in a private sector forum that we had last year, whereby we met with several business organizations, and we looked at they implementing a workplace, developing and implementing HIV workplace policy to address these issues, no?
And in close, I mean, and in terms of all of that, there are still all those gender issues that need to be addressed. Gender-based violence, you know, all that
and they're
stuff.
All linked.
And they're all linked. So if we do not address all those things that really provides and creates situations of barriers, then we'll not be able to reduce to our prevalence rate of HIV/AIDS.
All right. Well, quite a well-rounded conversation this morning. And we really appreciate you being here to provide this update. And especially as you pointed out, World AIDS Day comes up on December 1st, which means we will be hearing more information. And this really sets the backdrop for it.
I think so. This was a great opportunity. I want to thank you for having us, and that you will be hearing from different segments of the society on their issues related to the control of HIV/AIDS in the country.
All right.
And World AIDS Day 2016 is under the theme Hands Up for HIV Prevention, which deals with all these same issues, which is barriers and prevention and education and everything else. So,
all right.
Exactly.
So thank you once again.
No, thank you.
We're going to go ahead and take a break, and when we come back, we'll be talking about the Belize International Film Festival. So stay tuned.